At the onset, thank you, Chitra, for this opportunity. I'm going to go Zoom up because we are running late. I've been doing bladeless LASIK since 2013, so it's not that I've started yesterday. Now you can see that I have a decentered femto flap. So if you can see, surprisingly, the hinge is here, exactly at the pupil, and I've also managed to do a little bit of femto energy on the conjunctiva. So this happened in 2018. And this, you must understand that you know your technology, and this was one of the initial mistakes that I've made. So I'll explain to you why that happened. As I mentioned, I'm doing that since 2018, 13, now coming to this. So as far as we do bladeless flaps, the bladeless LASIK flap can be decentered, but we don't need to worry because our excimer treatment is on the pupil. So that is completely fine. So you can have a slightly bladeless LASIK flap which is nasal but not temporal, and the patients will still do well. And we know that when we do LASIK, the pressure of the eye goes up and the pupil dilates in different directions. So now the applanation area that you can see in bladeless LASIK on the Zimmer system is the entire limbus. So you can see the limbus, you can see how the flap is going to be created, and everything is quite visible. But when it comes to lenticular surgery, it's quite different. So on the Z8, I can do cataract, LASIK flaps, lenticular surgery, intacs, and corneal applications. But when it comes to lenticular surgery, you can notice that the limbus is not visible. So the pupil is visible very well centrally, and it's perfectly centered, you can see that, and it automatically aligns till 15 degrees in the lenticular system as far as the Z8 is concerned. So you can see that we can't see the limbus, that is part one, because of the camera angle in the system. So the camera angle in clear is different from the camera angle as far as bladeless LASIK is concerned in the Z8. So here you can see that the applanation area appears smaller, so you can't see the limbus, but actually the whole area till the limbus getting applanated. When the pressure of the eye goes up, the pupil dilates in different directions, and so if you try to do a pupil-centric treatment, it may not be the perfect way to go around. So I believe that the best thing to do is to mark, okay? So lenticular surgery, the centration is extremely crucial. And so understanding the technology is very important. So the camera angle inside the system is different when it sees in different steps of the procedure. So you can see this, actually it's an optical illusion. This is how the photograph is actually taken, and the camera angle is most important. So Shady Awad's marker is used quite commonly. I further modified it. Okay, so here you can see as far as the lenticular extraction is concerned, it has to be perfectly centered. So this is the marker that we have created. It is almost similar to the marker that Dr. Ramamurthy showed you, but I have removed the center part and made the extension longer. And what I do is I use the Virion technology for marking. So I take the patient to Virion, mark there, and this can never go wrong. So mark in spherical errors and mark in spherical cylinder errors. I personally believe that not marking in spherical errors may also be a mistake, and that may also give not perfect results. Once I have marked, I put a drop of dye because that will get your mark more accentuated. And then we apply the applanation as far as the Z8 is concerned. In Z8, the marking automatically aligns till 15 degrees, so you don't have to worry about alignment. So that is one big advantage as far as the Z8 is concerned. So you can see this is how it goes. And once it automatically aligns, we don't need to worry as far as the centration is concerned. And now you can see I still make two cuts. I don't do a single cut. The right one goes anterior and the left one goes posterior. So I'm not going to struggle with which plane I'm in, etc. And that makes the life much more easier. Just go with one side, and that's the Rhine-Einstein dissector, and the left side goes posterior. Go ahead, hold the lenticule and get it out. So according to me, marking is very, very crucial. So you can see that I've marked it perfectly, and this can never ever go, and comes quite to the center. The Awad marker marks only till here, and that's why sometimes it was a struggle. And here you can see that it automatically aligned. I didn't need to do anything to align the marking, and that's one big advantage. And let's see one more video. You can see the marking, okay? So now we build up the pressure, the pupil slightly dilates. Once the pupil slightly dilates, you dock on the handpiece. Once the handpiece is docked, Now we go ahead and make the alignment. Now you'll see that it automatically rotates. You can manually also rotate it. That's another big advantage, that you are just aligning the axis and manually rotating it and making sure that it aligns perfectly. So post-operative images is extremely well centered. You can see these are post-op images of clear or a lenticule procedure, and very well centered, and there is never a problem. So the outcomes depends on pachymetry, laser energy, of course, as rightly showed. Look for the gas bubbles, stromal fiber arrangement, Corvus if necessary, lenticule centration according to me is important, shape of the cornea, of course the surgical area, etc. And if you don't understand more, I always say ask Rohit Shetty. Thank you very much.
Thank you very much, Dr. Kumar. That was an interesting talk. I'm glad you insisted on talking.